Hello, I'm Bill Hearl. I'm chairman of the board of We Vax. I was trained as a biochemist at the University of Tennessee in Oak Ridge and in Knoxville. So I started out my career actually working on some elements of brain biochemistry, but quickly I moved into the immunology field and started looking at things that were being activated by cells that were in response to viruses. And so actually my first professional job in the industrial setting was working on tests to detect antibodies against HIV and also another related virus, HTLV1. So these were very important viruses, and this is an important tool that is a component of the vaccine work, is that we have to understand just how much antibody is being produced by people when they're exposed and how long do those antibodies last. So that was a very important part of my career. And then I moved into a number of types of roles where we were working on building tools to understand this immune response. In the late 1990s, I started working more seriously in vaccine research, and in particular, vaccines that were based on nucleic acids. You've probably heard in the news lately about RNA vaccines and DNA vaccines, and that these are really new vaccines. But the reality is they've been around since the early 90s. I actually did my first immunization with DNA in 1992. So we've been working on this for almost 30 years, and it's been steady progress. As they say, it takes 30 years to become an overnight success. And so now with the COVID-19 RNA vaccine being a good candidate by two very strong companies and people that have long experience in inducing immune responses using nucleic acids, I feel comfortable with the safety and now it appears perhaps the performance as well of this style of vaccine. So for the last 2 decades, I spent a lot of time working on how to use nucleic acids and these RNA and DNA vaccines to induce immune responses. Our personal focus moved in 2 areas. One was in creating a vaccine against allergies that's still working in the clinic, and the other is now in immuno-oncology. So my primary focus professionally is developing an immune response that attacks glioblastoma, a very deadly form of brain cancer. And so that, as part of our work with that, one of the things that we've come to realize is that patients are as important to the drug development process as the researchers developing the products themselves. And so we've become very big advocates of patient advocacy groups for cancer, and now also for We Vax. And we elected to be part of the founding group We Vax, not because we are working particularly in infectious diseases, but because it's important for people to understand and be aware of the key features that activate the immune system, help we understand why it's safe and why it's effective. And so you need an important resource of quality information so that you can make your own decisions and you can understand why these vaccines are so valuable to you and to the health and safety of your family.